I explain in this video what a lumbar disc herniation is, what symptoms it can cause, and above all, what its most frequent causal factors are. First of all, let me explain what a herniated disc is. We have it right there on the screen. A herniated disc is a disc, which is the purple area, that is ruptured, allowing the gel-like substance inside to leak out and compress a nerve root, which is the pink area on the screen. We have the spine, which is a flexible spine that can bend in all directions, and we can see that between each vertebra, we have this more orange-colored area which is the disc, okay? We have a disc between each vertebra. The disc is like a cushion, like a mattress, but it's filled with water or jelly-like substance, okay? Then, when this cushion ruptures and bursts through its outer shell, it can release the jelly-like substance that we see in the image, okay? Here we have an anatomical model with two vertebrae, the superior and the inferior, and they need to have mobility so they can move laterally or anteroposteriorly, to bend forward or backward, right? A little bit at each vertebral level, okay? When this disc receives a lot of pressure, it can burst and compress the nerve root that exits through a little hole, called the intervertebral foramen. I'll explain it to you in a closer shot. Here we have that disc. This is the intervertebral foramen, where this nerve root exits. This yellow area is the root. This would be the sciatic nerve, which, when there is a disc herniation, hurts along the entire back of the leg, right? Because it's cut here. This would be the root where the sciatic nerve emerges. Well, when this disc ruptures due to sustained or intense pressure, both can be factors. It can compress and invade the hole through which the nerve root exits, causing inflammation and irritation of the nerve, and resulting in the typical sciatic nerve pain, pain in the back of the leg, loss of strength, loss of sensation, tingling, intense tightness and tension in the entire back thigh musculature and even the calf. It can even cause pain in the sole of the foot and ankle. The lower the pain from the sciatic nerve, the worse the herniated disc. If the pain remains in the gluteal region or mid-thigh, it has a more benign prognosis. However, it's all sciatic nerve pain caused by this herniated disc. It's also worth noting that this herniated disc can worsen due to arthritis. In this image, you can see the top disc is healthy, with good thickness. The second disc is more flattened, dehydrated, and has lost height due to aging. The third disc is very aged and has advanced arthritis, and the disc is almost disappearing. When this disc disappears, it loses height, and the hole mentioned before narrows. As the hole narrows, small burrs can form and invade the hole of conjunction, reducing the size of the space for the sciatic nerve to exit. If there's a small hernia or protrusion, the beginning of a hernia, along with small burrs invading the hole, there's almost no room for the nerve to exit, which results in irritated, compressed, and strangulated sciatic nerve pain. That's the description of a herniated disc. What are its causes? Well, the typical causes that we all consider are traumatic factors. One can be, I fell from a height of 2 meters, I hit my butt while skiing, for example, slipped, or a car accident. Then there are microtraumatic factors. Microtraumatic factors relate to those who are standing all day, crouching, lifting weights, lifting heavy weights. Sitting for a long time is also a microtraumatic factor because when we sit, the discs in the back have a certain curvature in the lumbar area. But if we lose it, like when we sit very bent, the discs and the back change posture. The discs are compressed in the front area, they are flattened and little by little favor that herniated disc. If one sits up straight, the discs suffer much less. If one lifts weights with their back straight, bending their knees and hips properly, the discs suffer much less. If one bends down with a hunchback, the discs suffer more, or sits with a lumbar hump, the discs suffer more. These will be microtraumatic factors that, over the years, dehydrate, damage and flatten the discs. But I want to finish this video by telling you something that is important for you to know. Many physiotherapists do not know that frequently, behind a herniated disc, for this disc to end up bursting and causing the release of that pulpy nucleus of that gelatin, frequently, an intense triggering factor is needed. And this factor usually tends to be a visceral imbalance, a malfunctioning visceral, which is a visceral dysfunction, not a disease. Because we have talked about a disease, not a malfunction. For example, the kidney, a malfunctioning kidney due to stress, poor nutrition, exhaustion, will cause certain areas of the back to become stiff and, above all, the L5 and S1 disc, the last lumbar disc, to flatten to the left side and cause a left L5 S1 sciatica or herniated disc, or an irritated intestine, also due to poor diet, will cause a flattening of the fourth disc, between the fourth and fifth vertebrae, the fourth lumbar disc, to the right side, and will cause a right-sided herniated disc with its right sciatica. The uterus, prostate, that is, poor gynecological development, can also cause herniated discs. These organs I have mentioned, especially relating to the lumbar area, are sometimes the fundamental cause of a herniated disc. Sometimes lifting a weight, picking up my child and getting stuck, and getting a herniated disc, is the last straw that broke the camel's back. That disc was about to break due to a visceral factor that has been compressing the disc for years or months, and sometimes that wrong movement is the last straw that makes the glass overflow. So, we should care about the last straw, yes. It's like how you bend over, but we should care more about what the glass has been filling up with, and in this sense, these visceral factors are fundamental. In any case, if you want to learn more about these visceral dysfunctions, I'll leave you a note here and I'll tell you what is a dysfunction. Each organ where it gives reflexes, etc., etc. Thank you for watching and remember to subscribe to OnSalus Health.